Hello, everyone. Welcome to a CoverRight video production. And today we are going to talk about financial planning and healthcare. I am your host, Joseph Katz with CoverRight. I am here with Richard Chan, our CEO, and Marc Butler, who is both an advisor to CoverRight and the president of Skientist Financial Services. How are you both doing today?
Doing great.
Excellent.
Thanks, Joseph.
Great for you to be here. So I have two stats that will hopefully kick off this conversation and we can go from there. So 98% of financial professionals believe that it's important to discuss healthcare with clients. However, only 17% of financial professionals are very confident in their ability to discuss healthcare. So let's jump into this and figure out like what we could do to help people navigate healthcare and retirement financial planning. So Marc, Richard, why do you think healthcare costs are an important part of this planning process?
Well, look, it's every consumer, every citizen in the United States is affected by healthcare costs. And so it's something that we all have to deal with. It doesn't matter whether you're rich, middle class, or poor. It's something that all of us are going to have to deal with. And the reality is, with people living longer, and that continuing, and I heard a stat the other day that if you're alive in 2030, you're likely to live, there's a high likelihood that you would live until 100. With that type of longevity, people really do need to plan better for their medical costs, and the reality is that they're not today.
Richard, anything you want to add to that?
Yeah, I mean, I think it's an important part of financial planning and retirement, because the intersection of health and finance becomes more intertwined as you get older. And that's really the premise of when we started CoverRight, that health is going to become a financial asset in the future as the burden of healthcare costs shifts towards the consumer and the overall increase of healthcare costs across the market. And so thinking about what healthcare costs are in retirement, making the right decision, which is why we started with Medicare, is super important. And it's only become more important as the Medicare market itself starts to shift to become more of a private funded market, where private carriers are helping to deliver the Medicare services to customers.
So Richard, I know that you and I have spoken about this in the past, but maybe for those who haven't heard this, there's a assumption that Medicare is both free and that's your only cost, that covers all your Medicare medical costs. Maybe you can shed a little light on that as it relates to this specific topic.
Yeah. I think a lot of people do assume that Medicare is free and it covers a lot of things, but the reality is it's actually not free. Only one portion of it is, which is your hospital coverage that you pay for during work. Other than that, your medical coverage, so anything that's outpatient, you actually have a premium and out-of-pocket costs. And in addition to that, you have to get separate prescription drug coverage, which has its own costs related to that. And if you want supplemental health coverage. And so all of those have their own costs. All of them have out-of-pocket costs. And I think, the estimate I was looking at the other day is that, the current, someone turning 65 today needs to budget up to about $5,000 or $6,000 in healthcare costs a year, which covers a bunch of those Medicare costs within that.
And correct me if I'm wrong, but that does not include in-home care or long-term care, correct?
That's correct. Yeah, it doesn't include any of those. It's really just medically necessary healthcare services for like hospital and medical.
So Marc, you and I were chatting a week or so ago, and you used the phrase holistic financial planning. Maybe you could explain what that means and how planning for these costs, specifically if someone's going to need long-term care or, as Richard said, $5,000 a year in medical costs above and beyond. How does someone do that, and what's the best approach?
Yeah, traditional financial planning has kind of moved from a focus on accumulation to more holistic life planning, which is not only talking about accumulation, but also what happens after someone retires or stops working as much. And so, holistic meaning all aspects of someone's financial life, which could be their investments, it could be their insurance. Healthcare plays a significant part of it. And, when you think about what do retirees fear the most, rising healthcare costs is one that is at the top of the list. In fact, 75% of retirees put healthcare costs in the top or second position in terms of their fears. So this idea of holistic life planning or wealth planning, healthcare plays a very critical role in that. And so the perspective of advisors needs to be more holistic and needs to look towards a future where it's going to be common for people to be living to 90, 100, maybe even older than that.
So, Richard mentioned that people think Medicare covers a lot of this stuff. How can a financial planner, advisor help consumers navigate healthcare with more, practical advice and information?
I think for most advisors, it starts with educating themselves and understanding, do they really know how Medicare works, and are they in a position to help their clients through it? And so much like they might help a client through the investing process, putting money into a mutual fund, a stock, an ETF, same kind of thing. Do they know enough to guide clients through this process and understand where does Medicare fit in? When is somebody eligible to use it? What are the options? Most advisors are just not in a position to even talk about it today. So one, I think it starts with education. And then two, I think it goes quickly to ownership, and advisors need to own that conversation with their clients and not just outsource it, which, it's interesting. The ones that do cite they're having these conversations about Medicare with their clients are often just delegating it or outsourcing it off to somebody else, and the client is left off to figure it out on their own. And that's really the ownership piece of what I'm talking about. Advisors need to own this conversation with their clients.
It's an opportunity actually to build a deeper relationship with those clients. I heard the phrase retirement 2.0 recently, which is about, people retire and there's still a lot of years left, now for people to live. You mentioned, living to 100. So I think it's an opportunity for advisors to become part of that sort of secondary planning stage of life. Richard, I know you've built some tools to help financial advisors. Maybe you want to talk a little bit about that, and then we'll come back to some of the costs discussion.
Yeah, and I think that's just to touch on what Mark said. It's an interesting point that it's not more of a conversation with financial advisors at the moment. I'm sure there are sort of advisors out there that are helping with that, but the cost of healthcare is projected to be running at 2 or 2.5 times US inflation. And if you think about where people are investing their money and what they need to spend, like not fully accounting for that, not fully accounting for differences in lifespan between spouses, not accounting for nuances of how Medicare charges when you have different income thresholds is super important. But like you said, we are building tools to work with financial advisors. I think, the first point of call is we want to be a partner to this conversation. When a financial advisor is having this conversation with their customers, and we want to do that in two ways. One is we want to be an expert that advisors can lean on. And so we're building a tool that enables them to, one, refer clients to us in a warm sort of referral manner where they can start the conversation around Medicare, walk through some of the pricing. And, when they get to the point where, we're getting into detailed coverage around maybe drugs or specific health conditions that need to be covered, we kind of step in and help with that to make sure that the customer is getting, you know, the best plan, or the client is getting the best plan that's right for them at the best cost for their ability, for their financial budget, as well as for their risk preference.
You mentioned inflation, which is right now, you know, roaring. Obviously, you know, financial advisors help people plan to extend as much of their nest egg as possible. How much focus should there be around healthcare planning as it relates to the cost continuing to rise?
I think it's super important. I mean, I think at the moment, the projections, and I don't know if advisors are actually how they're calculating it in depth today, but the projections for 2021 to 2029 of just the Medicare Part B premium is that it's going to go up by 6% each year, which
Wow.
is that's the baseline Medicare cost. And so then you add on top, you know, the Medicare supplement plans or dental, vision, hearing, prescription drugs as well. And I think, you know, there's going to become a bigger gap over time in really, you know, hopefully we will help plug this with some of the data that we will collect over time, but like prescription costs as it relates to certain chronic conditions can really throw off some of these numbers.
Yeah, I mean, you mentioned just some of the costs, right? So there's you have the premium costs, you have the out-of-pocket costs. I mean, it's just going to continue to grow with inflation. So it's definitely something to plan for. Marc, as a financial advisor, planner, someone who's worked in this industry, what would you say are 2 or 3 things advisors should be doing now to help their clients?
Well, I'll go back to education and just advisors themselves getting smarter about the space and about the concerns that people have. That would be number one. Number two, you know, take ownership of that conversation. And, you know, number three is help your clients understand the importance of planning effectively for this, because it's you know, it's an area where I think people, because there aren't conversations going on, people are largely underestimating what it could be. And look, this is less to me about planning, whether you call it financial planning or holistic planning. I mean, this is a societal challenge for us. I mean, what are we going to do? Have a bunch of people in their 90s, 100 years old, that we're not supporting them because they don't have the money for this. They haven't planned effectively for it. But that, you know, if you fast forward 30-ish, 35 years, that's what we could be dealing with. So, you know, there's some urgency behind this to tackle this challenge right now. And, you know, advisors are kind of the lifeblood of clients from a life and wealth planning standpoint. So this is, you know, they need to take this seriously.
Good point. Definitely going to be a society issue at some point, if not already. Richard,
I was going to say, to add to that, there's things that, and maybe advisors, you know, Marc, you'll have a better sense of this, like maybe they are talking about this, but, you know, there's things like, you know, health savings accounts that are becoming a lot more popular as high deductible health plans within the employer coverage realm are becoming more popular. And so there's things like that, other kind of investment accounts that can help with, you know, tax-free or you know, other ways to grow that balance that you've allocated to healthcare costs over time that can happen before someone even retires. And so there's a lot of things that can happen then. And, you know, where we step in at CoverRight is at that point when you are retiring, hopefully we are working with you, the advisors, to really give a more accurate assessment as to, you know, what are the ongoing costs in the future. And there are going to be situations that, you know, there's going to be new drugs or things that happen, some life situation happens and it changes the plan, and it's important to keep abreast of what those healthcare costs could be.
Richard, so I was going to, you know, basically talk a little bit right now for a second about the fact that, you know, CoverRight was built as a direct-to-consumer platform to help consumers navigate Medicare, find the right plan that meets their preferences, budgets, and so forth. Maybe just for a minute or two, talk about the costs that people could be incurring if they make the wrong decision as a consumer. And then, maybe you can segue into how a financial planner can assist in this decision-making process.
Yeah, I mean, I think the biggest one that probably a lot of people get wrong is, firstly, one is making sure they're enrolling in Medicare at the right time. So there's penalties and things like that for not enrolling in a plan when someone needs to, which is during their 65th birthday, unless they have other reason not to. So the penalties can be up to 20% a year, 10% a year for every year that they miss having the Medicare in place. The second is really making sure that the clients, like I said earlier, understand firstly the drug costs for their prescriptions. We've seen in certain instances the same drug costs 200 to 300% more in two plans in the same zip code. And the reason for that is, the plans, the way they work is they have to do their own negotiations with the drug manufacturers and the pharmacies. And so it comes down to their contract negotiations. And so just because your current insurance from work covers it well, doesn't mean it's going to get covered well when you go into Medicare. And so making sure that the client actually understands, what their drug costs would be, particularly if they have pre-existing conditions when they're moving into that 65-year-old retirement age. And then the last one is just really helping them understand what their risk is in a catastrophic scenario. And there's different products out there that cover that very differently. And Joseph, you and I have spoken a lot about like Medicare Supplement versus Medicare Advantage conversation. They're very different ways of getting your healthcare coverage, and depending on what it is, like the upfront costs that you're paying versus what we call like back-end costs when you actually go and use the services can be very different.
So where do you see the financial advisors, planners, kind of merging here? Yeah,
I mean, I think and Mike might have some input on this, but I think advisors are going to be pushed, even if they're not proactively doing themselves, over time to have this conversation on healthcare. And so, our goal, like I said, at CoverRight is in the first instance, be a partner for people who are starting to have that conversation, both on education to the advisor and their client. And we're happy to as much or as little as the advisor wants, while keeping them in the loop so they can be part of that decision and really understand at least the cash and the cash inflows and outflows of what the healthcare costs would be. I think, over time, what we would love to do is be able to provide better data around what is it going to cost over an extended period for advisors and their client, and as they're planning for their clients, these healthcare costs. And as we get more data on the clients who come through our platform, the prescription drug costs, inflation costs, as we start to ingest that over time, the costs, like, the Part B premiums increasing, the plan and the Medicare supplement plans increasing, like hopefully we can serve that data back to advisors over time.
Mark, is there anything that you think CoverRight could do for advisors to help them do their jobs and inform their clients better?
Well, look, I think you guys are doing it. I think you've created the easy button around Medicare for advisors and for anyone delivering financial advice in the wealth management space. You've created education that's not only advisor facing, but it's consumer facing. It's easy to use. Advisors can easily facilitate a conversation using your solution, show clients options, actually guide them through getting into an option, even doing it for them. And so it's really a win for everyone in that wealth management value chain, but especially for the consumers. And like I said, you guys have made it easy for advisors and for, advice providers to be able to do that and have that conversation.
We won't tell Staples we borrowed their easy button.
I do all the time.
So I guess we'll leave everyone with a couple of thoughts. One, if you're a advisor and you have questions about Medicare, Richard's happy to chat with you. You can reach out to hello@coverright.com. If you just want to learn more about Medicare, we have tons of videos and recordings and information on learning.coverright.com. And we're happy to showcase the platform. If you're interested in working closely with us, just reach out, and appreciate your attention and joining us today. Mark, appreciate you being here. And Richard, I'll see you again probably in a few minutes.
Thanks, Joseph. Thanks, Rich.
Take care. Thanks, everyone.